Good afternoon, everyone. Let me, first of all, I think when we're talking about technical assistance, I don't have a presentation, by the way, so you just have to listen to me talk and take notes and be attentive. I think when we're looking at technical assistance, it's useful to think about broader categories of the context. Which context are we talking about providing technical assistance? And if you look at it from, I'm coming in it from a more of a donor perspective, sitting, organizing and being in charge of larger programs. So if we look at the fragile states, that could be one category. And then we look at, it's more of a, not necessarily just technical assistance, but it's more of implementation support as such. If we look at the next category, which will be states that are very heavily dependent on aid, and their human resource capacity is weak, then we're going into an area where we're both having implementation support in terms of technical assistance, but we're also having kind of real technical assistance in the way that we would like to talk about it. And I think moving to the third category countries are when the countries that are less dependent on development aid, and they have a relatively a better functioning human resource system, better policies, etc. And I think definitely India is an example of a country where the modalities for aid is changing. There is more and more national ownership, and there's more harmonized approaches, there's more pooling of funds. It's not a lot of individual case-by-case interventions any longer. There's what we would like to see with technical assistance is then that to have some kind of a transformational role more than a transactional role. We would want to see this leading, as you rightly say, that all these different things we would like to impact the system around what is happening, not just intervention itself. But having said that, I think the provision of technical assistance is mostly not viewed in the context of the overall human resource management, particularly not in the public sector. I work in the health sector, and I think a lot of agencies are involved in technical assistance. It's not that we're looking into the HR policy of the country and we're looking at, okay, where are the gaps in the HR policy, where are the gaps in the HR, how can we improve on the technical assistance in those particular areas. I think we're more looking at it as a little bit as a free good, that we have some interventions, and we throw in some technical assistance because we know that in order to get the intervention going, we need outside capacity in order to make it move forward. So it's not really considered, and I think it's very good that we're kind of moving towards this area where we're actually thinking that technical assistance is, in itself, is not just something we do as a throw-in in order for us to make sure that the intervention that we want to do is successful. Because if we're looking at it from that perspective, I think it has very negative consequences for sustainability if you're just adding more people into the picture. I think also that we can look at TA from different. Within India, we have different, in the health sector, we have different models for technical assistance. In the Norway-India Partnership Initiative, we did one type of technical assistance, and I'll talk a little bit about that in detail, where it was fully integrated within the National Rural Health Mission. DFID has launched programs during the different task teams in the states, where they are partly integrated, I would say, because they're definitely working very much alongside the National Rural Health Mission, now the National Health Mission, but it's also partly separate because it's through third-party agencies. The people who are recruited to those, they receive higher salaries. They have different benefits than the people who are currently in the government system. So their approach to the whole work that they're doing is somewhat different. And I think that we have also, Japaiko is here in the room, so it's an example of an NGO that is very much sustaining itself by providing technical assistance to the government in order to make interventions move forward. Which is again, the technical assistance is separate from the government system, and it's organized completely as a third party that are working with the government, but they're not necessarily sitting with the government. They have different offices, they have their different protocols, their different policies, etc., that they have to follow as well. So all these different models have separate challenges and positive, different positive sides to them as well. I think one of the dilemmas that we face as development partners and donors is that, are we providing real technical assistance, or are we just filling vacant posts within the government system? And I think that's a tough one to deal with, because definitely in so many developing countries, there are HR constraints. So do we just say that we're filling the gaps and calling it technical assistance, or are we actually, what technicality are we added onto the different program by adding the people that we want to place to do that particular work? And how does that then impact of the government workers? Are we replacing some of their tasks? Are they more eager and to learn from other people who are coming in from the outside with maybe better knowledge, better capacity, and better competencies? Or are they taking the other side where I'll just sit back and relax because now somebody is here who can do my job, so I can be on Facebook, or I can do something else instead of actually having to do my job. So there are a lot of dilemmas that we're facing with this technical assistance, and how do we make sure that it's to the best of our idea and vision and ideology, the best way that it is. I think I just wanted to take one example of one. We actually did it with Sambodhi, and they called it an impact evaluation. I'm not so sure whether it actually is an impact evaluation in the strictest term of an impact evaluation. It's maybe more of an impact assessment. But anyway, we provided some technical assistance to the government, and we, in hindsight, we tried to look at, okay, what did this lead to? And this was we started off in 2006, 2007, just when NRHM had been initialized. The people at the time, they analyzed a little bit of the health system, and they saw that there were large funds being pumped into the public health system, but little or nothing was done to strengthen the administration at the block and district level in order to make sure that these funds could actually be used and be kind of transformed into something that was programmed, and make sure that activities were happening at the ground level. And so we saw that in the beginning of the National Health Mission, that the absorption capacity in the first years were very low. I think in some states the absorption capacity is still very low, and there's been a lot of fuss about this 20% cut in the health budget. Is it a real 20% cut, or is it just sending money back to the treasury that was never going to be able to be spent in the first place because of the absorption capacity of the states? So I think there are different ways of looking at it, and that's a political statement. I'm not going to go into that. But anyway, so what we did was we provided, so one suggested interventions, and I think looking at this now on the intentional design was extremely simple. It was coming from the fact that, okay, here there are lots of money coming into the National Health Mission, or through the National Health Mission to the public health sector, but there are no staff who are actually, at the block and district level, they are not, and even at the state level, in some states, they were not provided with additional staff in order to make sure that these funds could be utilized from an administrative point of view. So the design was then, okay, we will provide some assistance to that, some child health managers at the block level and at the district level. They were recruited on terms of the NRHM. They were to work with the NRHM. They all traveled, their DSAs and whatever was according to NRHM rates. So they were not treated as somebody who was kind of more valued in terms of remuneration, that they were on staff. They needed, we call them techno-managerial support, because we wanted them to have some technical understanding of the different components of the NRHM when it came to child health. And we also wanted them to have managerial capacity. But the terms of reference were fairly broad, and when they were recruited, we had a lot of different people applying. We had everything from somebody with a master in IT, to somebody with a public health and somebody who was a nurse and somebody, were more in the health area and had been working more technically themselves, but now wanted to try and test themselves more on the managerial side. So though they were, and they started off, I think, with a very clear vision from when the program was initiated that they should have that combination of some technical understanding combined with the managerial responsibilities and competencies. So we did this assessment, impact question mark what it was, but it was, and Sambodhi did this in 2013-14. And the findings showed that the support was welcomed by the states, as most of the staff had been absorbed into the NRHM system. So if that is one of the sustainability criteria, these people were actually put in addition to the regular staff, and then the state saw the value of them, and they were absorbing them into their own system. And because they were on equal remuneration terms as their own staff, the state found that quite easy, because they didn't have to offer them less salary than what they potentially would have been if they had been recruited from a third-party agency that would, attract higher salary, etc. So that was, I think, a positive output of this one. We also saw that there was quite a lean structure in the organization of it. And that also made it easy for the NRHM to take over and roll them into their system. They had received fairly good training support. They had received some special technical managerial skills training from different, reputable Indian institutions. So they felt that their capacity and competence to actually do their work had been enhanced by the training support that they had gotten from us. One thing that we found, that though they were provided to the NRHM in order to provide services, so that all types of child health services, they tended to focus over time more on the typical NIPI interventions that we were introducing in the States. So though they had been given a fairly broad platform to work, kind of time was probably one of the constraints, and probably also because they felt some level of responsibility to the agency who were doing different types of kind of the NIPI, typical development intervention. Time was kind of moving into being focused on that, because that's probably where they got questions from the implementing partner. Can you look into this one? Can you do this one? Can you make sure that the files are being pushed so we can start doing our work? So that was one of the challenges, that the supervision mechanism and the was not really there in place to make sure that they were focusing equally on the different tasks, or that they were following exactly what the NHM wanted them to focus on. So whether it was immunization or whether it was other types of interventions. And I talked about the hand-holding and the supervision. And I think that is, when we're talking about when we do the third-party recruitment, that can be a challenge on how much, from a donor perspective, do you outsource everything to the third party and you let them do all the recruitment, and how much in that role of the third party agency do you follow to make sure that they are actually supervising the people that you have been provided as technical assistants, and they're not just, okay, I've recruited all these people for you, and they should work. Our hands are kind of, I just make sure that they get their money every month, and they get their holidays, and they get whatever benefits that they get with the contract. But how do you pack that into the contract from the donor perspective onto the third-party agency, so they're actually doing supervision of the people, and they're also doing some capacity building of them as time goes by. I think my previous colleague touched upon how do you measure impact and outcome and input, and how do we know what elements actually work if the totality provide results, and do we actually need to know? doing a lot of evaluations are also very costly. So from a donor perspective, you would always try and get the most money out of what you're putting into there. And for a lot of people, I'm not saying that I'm one of them, but for a lot of people, evaluations is normally the ones that are thought of at the last. And when there's hardly any money left in the budget and everything has gone into different types of, supplies or staffing or whatever, office supplies, then you gotta, oh yeah, we have to do some kind of reviews and some kind of evaluation. Yeah, we'll throw it something at the end because that's easy to deal with. Whereas if you integrate it into your whole package, it tends to become, not always, but it can become quite big, very ambitious, and at the end of the day, are you actually able to differentiate what is changing because of technical assistance and what is changing because the environment is changing, or what is changing because economic growth or economic lack of growth is happening. So I think as it's good that we're getting more and more experience and we start talking about these things and thinking about it, how can we get these things evaluated in a meaningful way. And lastly, I'll just say a little bit about policy, because we would, all of us are talking about evidence policies, and we would want to contribute to make them, the country's policies, evidence-based, and how can evaluations contribute to that. But a lot of policies are not based on evidence. The policy is based on some kind of a hunch that this makes sense. And that hunch might be based on some kind of evidence, but the evidence for that particular policy tends to be developed later. The policy comes first, and then you have all the different researchers and the different consultants and everybody who's focused on the other side. They want to prove that this policy is actually working or not working, because the evidence takes so much time to develop, and a politician doesn't have the time to develop that. So, of course, you can say that for immunization, most vaccines we know are effective. So you can say by introducing a new vaccine, it's an evidence-based policy. But in that particular context, it might not be the right one, or the way it's being done. It's the how question that might not be so evidence-based. So that tends to be developed at a later stage. And how is that a problem? Or is that just how the life is, because we are governed by politicians who have less time, and that's the fact, and we have to deal with it. So I would just kind of pose that as a question to the audience in terms of what can we do to bridge the gap between the evidence of the policy and or making the policy as evidence-based as possible, because I'm not sure whether it's or should be a goal to make all policies evidence-based, because then things will take to be way too slow, according to many politicians, and they will not be able to kind of show that they are doing progress. But I think one thing is that we should try and kind of bridge that gap in a way that we are not doing completely crazy policies, and then you have to wait 100 years before the evidence catches up whether this was a good or a bad thing to do. So I'd like to end there and just pose that to the audience. Evidence to policy, policy to evidence, and what role does the evaluation community have in that space when it comes to technical assistance that we're talking about today. Thank you.
Thank you, Unni.